Ladies and gentlemen, this is an article that came out in the Daily Beast, April 13th, 2019. Now, rural America has really been going through a lot. They have been dealing with the opioid plague, HIV from needle sharing, mass incarceration is up, maternity wards are closing, schools are closing. Many of the young people are leaving the area because of the lack of jobs. And now syphilis is spreading across rural America. There's one more thing for them to deal with. Now, you would think, okay, syphilis is spreading across rural America, but why? Here's why. Many of the men in their 60s and 70s, they call themselves the Domino Gang. And what they do is they have a game night. And not only do they play games, they also have sex with each other. And syphilis has been spreading among these men in their 60s and 70s. Now, they're not the only ones. The younger generation are also being hit with this as well. So, this doctor in the article is talking about how these men are showing up to her clinic and they are testing positive for syphilis. And it's becoming the new norm in rural America because the pregnant women have it, the young men, the teens, and it's rapidly growing among her patients. And as she is talking about the penicillin that she tries to keep in stock, she's barely able to keep it on the shelves. Public health officials say rural counties across the Midwest and West are becoming the new battleground. Syphilis is still concentrated in cities like San Francisco, Atlanta, and Las Vegas. It continues to spread into places like Missouri, Iowa, Kansas, and Oklahoma. Creates a new set of challenges compared with urban hubs. Rural populations tend to have less access to resources. Um, they are less experienced with syphilis, and they really won't get up and get themselves treated either right away. So because they're stalling these things out, it's also contributing to the syphilis spreading. So in Missouri, the total number of patients with syphilis have quadrupled since 2012. And it went from 425 up to 1896 a year ago. According to the Kaiser Health News analysis, the state health data, almost half of those are outside the major population centers, typical STD hotspots like Kansas City. Syphilis cases surge at least eightfold. Damn, eightfold during the period in the rest of the state. So the blue is showing you the major metropolitan areas where syphilis has been on the rise since 2012. And the yellow are your non-metropolitan areas. Well, it looks like it's rising there too. Definitely is. So, this doctor is talking about how her caseload has increased, and what she is witnessing is something that she has not seen in the history of working as a sexual health care, I guess, in her field in sexual health care. Back in 1999, the Center for Disease Control and Prevention had a plan to eradicate the sexually transmitted disease that totaled over 35,000 cases nationwide that year. While syphilis can cause permanent neurological damage, blindness, or even deaths, it is both treatable and curable. Now, All right. So, by focusing on the epicenters clustered primarily through the South, California, and in major urban areas, the plan seemed within reach. So the US in 2017 had 101,500 cases, and it continued to rise with other sexually transmitted diseases. Syphilis is back in part because of increasing drug use. I told you. I knew this had to do with the drug use. And so is HIV. I did an article probably about 2 years ago on how the HIV was rising in rural America. And the story that I did, I believe it was in Indiana, rural America in Indiana, where HIV was exploding. Okay, so the public health officials say they are losing the fight because of the combination of cuts in national and state health funding. And that is one of the number one things that people have been complaining about Trump. They said Trump is not providing enough funds for them to fight all of the drug abuse that's going on out here, because it's going to have that effect where it's going to impact other things, and it's all going to point back to the drug abuse. Okay, so it's really astonishing to me that in the modern Western world, we are dealing with the epidemic that was almost eradicated. All right. So right now they are dealing with HIV, STD, and hepatitis, and now syphilis. Um, in small towns, younger patients fear their local doctors. They don't want anybody to find out that they have syphilis. So, the younger people tend not to go to the doctors, or they'll hold out as long as they can because they're afraid their parents will be called, or somebody will spot them going in to the medical center and start gossiping about it. Some men haven't told their families they're having sex with other men, and still more have no idea their partner have cheated on them, and their doctors don't want to ask according to high fill. So some doctors may not be asking the right questions when the patients come in, and that's why some of the syphilis is not being caught. So, wow. So, syphilis can really impact people differently. Some people get lesions, some get rashes. Um, Sometimes a doctor really don't ask the correct questions to pinpoint what the lesions and rashes are. Since 2000, the current syphilis epidemic was most prevalent among men having sex with men. During 2013, public health officials began seeing an alarming jump in the number of women contracting syphilis. That's because those men are having sex with each other, and then they turn around and have sex with women, which is particularly disturbing considering the deadly effects of congenital syphilis. When the disease is passed from the pregnant woman to her fetus, right, it can cause miscarriage, stillbirth, and birth deformities. Among women contracting syphilis and the men who were their partners, self reported use of methamphetamines, heroin, and other intravenous drugs continue to grow, according to the CDC. hmm Public health officials suggest that increased drug use, which can result in a pattern of risky sex or trading sex for drugs, worsens the outbreak. All right, so now let's go down to this chart. The spread of syphilis into non urban Missouri counties. All right, so they're showing you a chart of syphilis cases from 2008. Wow. Yeah, to 2016, where you can see a lot more color in the state of Missouri. Okay. Federal funding for STD prevention has stayed relatively flat since 2003, with 157.3 million allocated for fiscal year 2018, but that amount to a nearly 40% decrease in purchasing power over that time, according to the National Coalition of STD Directors. In Missouri, CDC annual funding has been cut by over $354,000 from 2012 to 2018, a 17% decrease, even as the number of cases quadrupled, Highfill said. Iowa has seen its STD funding cut by 82,000 over the past decade. So these folks are just letting you know they're cutting funding, but they really need more funding because of the increase of all of the STDs and syphilis and everything that's on the rise. Highfill bemoaned that legislatures in Texas, Oregon, and New York have all allocated state money to raise awareness or provide transportation to local clinics. Missouri has not allocated anything. So this is bad, y'all. Wow. This is really bad. And a shame, but this is what people do, y'all. This is what they're doing out here. You're really taking a chance when you are around many of these drug addicts. You just don't know what they have. And the fact that people will stoop to having sex with anything for drugs, wow. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And I'll see you on the next video. Peace, family.